Welcome everybody to our afternoon on EVV, Electronic Visit Verification. And I'm Linda Litzinger, and I'm so very pleased to announce that HHSC has come to teach us about it. And today we have Alesia Brown as our main speaker. And Alesia, do you want to say hello?
Hello, everyone. I was trying to get my camera going, but I am unsuccessful this afternoon. So welcome, and thank you for inviting us. And we're excited about being part and working together.
Okay. And Lorelei Wetzel, would you like to wave or something, or say hello? Okay. Emerson?
I'll just say hi, sorry.
Very good. Emerson?
Hi, this is Emerson. Thanks for having me on today.
Thank you. Arthur Ortega?
Hi, everyone. This is Arthur Ortega, HHSC. Thank you.
Jorge Montemayor? And Stephanie Gutierrez. Okay. Well, thank you. And Alesia, I'm going to turn this over to you now.
Okay, thank you. Get my screen up.
Let me just say real quick, everybody is muted. If you have questions, please put them in the chat box. They will be monitoring, HHSC will be, staff will be monitoring it, and they will try to get to all of your questions. If they don't get to your question or need additional information to be able to give you to respond to it, we will email you after the presentation.
Okay, again, for being a part of the HHSC EVV Visit Verification. This is a Texas Parent-to-Parent presentation, July 28th. The Texas Health and Human Services Commission, HHSC, and our managed care organizations, MCOs, would like to thank you for inviting HHSC EVV operations to present at the Texas Parent-to-Parent Weekly Webinar today. This presentation will primarily focus on electronic visit verification. Going forth, we're going to be hearing EVV and the role of the Consumer Directed Services, CDS, employer. We are available to answer your questions about EVV if you selected the CDS option or not. Questions and answers. Please submit your questions as you think of them throughout the webinar. To submit questions, please type your questions into the chat box located to the side of the screen. Periodically throughout the presentation, we will have a break to answer any questions that have come into the chat box. Within 2 weeks, we will send the questions and answers to all attendees of the webinar via the email you registered with for the webinar. Topics overview. Topics that we're going to be discussing this afternoon: EVV overview. How does EVV affect me? We're going to have a break, a pause for question and answers. Then we're going to come back and talk about the EVV system. Form 1722, which is the employer's selection for electronic verification responsibilities. Then we're going to have another pause for question and answers. We're going to come back and talk about EVV training requirements for CDS employers, Cures Act EVV expansion timeline, EVV reports, next steps for EVV, EVV resources, and then we will end with questions and answers. So let's go ahead and get started with the EVV overview. So what is EVV? EVV is an electronic documentation system used to verify that Medicaid services have been provided to an individual authorized to receive those services. EVV replaces paper timesheets for EVV required services. EVV visits are required for EVV claims payment. So why are we doing EVV? State law and rules that require EVV in Texas are, as you can see, there's a list: the Texas Government Code, there's a Human Resource Code, our Texas Administrative Code, Chapter 354, Chapter 49, and Chapter 68. So state law requires EBV in Texas. EBV is required by federal law also. Section 1901I of the Social Security Act, as amended by Section 12006 of the 21st Century Cures Act. Going forward, we'll call Cures Act. The law requires that all states to use EBV for Medicaid personal care services and personal attendant services, including services delivered through the CDS option. The CARES Act requires all states to use EBV for Medicaid Personal Care Services, PCS, by January 1st, 2021. If we do not implement by this date, Texas will lose federal dollars for state Medicaid programs. The federal deadline cannot be delayed further unless there is a federal legislation to change it. HHSC cannot delay the implementation of EBV without federal congressional action. So I know there's been a lot of concern because of COVID, and if EBV is going forward, and until it is going forward, until we get that federal congressional action, we'll continue to move forward to implement. A list of programs and services is available on the HHSC EBV website. HHSC currently requires EBV for about 90% of Medicaid personal care services. So almost all our personal care services are required to use EBV. So let's look at some of our programs. Let's look at the programs and services required to use EBV. So our first program we're going to talk about is the 1915C Community Living Class and Living Assistance and Support Services Waiver, which is the class waiver. And the services required to use EBV are our Community First Choice and our Personal Assistance Services, Habilitation, which is our CFC, PASS-HAB, and in-home respite. The service delivery option is the CDS services also. So those that have selected CDS, if the services are for Community First Choice, CFC, PASS-HAB, or in-home respite for class, they are required to use EBV. The next program we have is our 1915C, our Deaf, Blind with Multiple Disabilities Waivers, our DBMD. Again, the services required to use EBV include CFC, PASS-HAB, and in-home respite. And the agency and the CDS option are required. In the class program also, the service delivery option is CDS and the agency model. So it's the both for both our CDS, for our class and DBMD programs. So our 1915C Home and Community-Based Waiver Services, our HCS services required to use EBV, our PASS-HAB, in-home respite, and day HAB provided in the home. That's only for those that have selected the agency option, okay? But if you provide HCS, receive HCS, and receiving the service of CFC, PASS-HAB, and in-home respite, and you use CDS, then you're required to use EBV. Our next program is the 1915C Texas Home Living Waiver. Again, it's CFC, PASS-HAB, in-home respite, and day HAB provided in the home. Next program is our 1915C Youth Empowerment Services Waiver, the YES waiver, and the services that are required to use EBV is in-home respite, and that's only for the agency model and not for CDS. Our next program is the 1915I Home and Community-Based Services Adult Mental Health Waiver, and the services required for that program include in-home respite, supported home living, habilitative support services. And again, that is for the agency model only. Our next program is our 1915K. This is our Community First Choice, and this includes those STAR members who receive these services through the traditional Medicaid model. Services, CFC PASS and CFC HAB. The service delivery option includes those who selected CDS and the service responsibility option, which is our SRO. Other programs include our community attendance services, our family care program, our primary home care program. And those services are all our personal attendance services. So you have your community attendant CAS, family care FC, and PHC primary home care. And the service delivery option for those programs includes CDS and SRO. Our next program is our personal care services provided under the Texas Health Steps CCP program, our comprehensive care program, including, again, those STAR members who receive these services through the traditional Medicaid model. Those services are PCS, personal care services, and the service delivery option includes the CDS and SRO. Our next program, these are our waiver programs. We have STAR Health, which includes services CFC PASS, CFC HAB, and PCS. And again, that's for the CDS, SRO model, including the agency model. We then have our STAR Health, MDCP covered services program, and that includes our in-home respite and our flexible family support services. Again, the agency, the CDS, and SRO models. Our next program is for STAR Kids. Again, we have the CFC, PASS, CFC HAP, PCS, and the service delivery option includes the agency model, the CDS, and the SRO. Next program we have is our STAR Kids NDCP covered services, and in that we have in-home respite, flexible family support, again, the agency model, CDS, and SRO. The other waivers are our STAR Plus. The services include CFC PASS, CFC HAB, and PASS. Again, it's the CDS and the SRO model, okay? And it's also the agency model. Our last program includes the STAR Plus Home and Community-Based Services, CFC PASS, CFC HAB, PASS, in-home respite, and protective supervision. It includes all the models, agency, CDS, and SRO. And I'm sorry, our last program is our STAR Plus Medicare Medicaid plan, the STAR Plus MMP. Our services include CFC PASS, CFC HAB, PASS, in-home respite, protective supervision, and again, that's for the CDS, SRO, and agency model. So now that we know about all the programs and services required to use EVV, let's talk about how does EVV affect me. So those that are CDS employers, you will use the EVV system selected by your Financial Management Service Agency, which is your FMSA. You will take required EVV training. Employers, you will train your CDS employees on the clock in and clock out methods, and we'll talk about that shortly about training. And then the CDS employee, you will ensure your CDS employees clock in and out of the EVV system when services begin and end. It's similar to when they were filling out that paper timesheet. Now they're going to be using the EVV system to clock in and clock out. Again, as a CDS employee, you will determine the best clock in and clock out methods for your CDS employees. You will log into the EVV system to approve time worked and perform visit maintenance depending on your Form 1722 selections. And we'll talk about those different selections shortly. As an individual Medicaid recipient, EVV will affect you. You will continue to receive services, but your CDS employees or your attendant, if you have not selected the CDS option, will record their time worked in the EVV system. Instead of on paper, they're going to record their time in the EVV system. Individuals, you will receive a copy of the EVV rights and responsibilities during your initial enrollment and annually thereafter by HHSC or your MCO. So it may be your service coordinator or maybe your HHSC case manager. That rights and responsibilities will give you, explain to you what your rights are and the responsibilities of the member related to EVV. As a CDS employee or an attendant, if you're the caregiver, you will receive training on the clock in and clock out methods. You will clock in and clock out of the EVV system. You will notify your CDS employer or your program provider of any issues clocking into the system. And then you're going to log your time on paper if there's an issue with the system and notify your FMSA or program provider. So if there was an issue with the employee or attendant using the EVV system, that attendant or employee can write that time in and the time out, and then notify your CDS employer, program provider, and you can write that information down, and it can be manually entered into the EVV system. So we talked about quite a bit so far. Let's talk about, see if we have any questions. So Linda
Hi,
has
Alicia.
said,
This is.
Emerson.
Oh, I'm sorry. Go ahead. I'm
Go ahead,
sorry,
Emerson.
Alicia. Thank you. Yeah, we have a question here. When the PowerPoint is sent to parents, will they be able to click on the URLs presented inside the PowerPoint? And the answer is yes. You can click on the links inside the PowerPoint by having it in presentation mode. Our next question, we have, will we receive a copy of the presentation? And Linda said yes, that she was going to send a copy out. The presentation will be emailed out to everyone. You may also visit the EVV homepage at hhsc.com for additional EVV training material and information. So that's the HHSC EVV website. And those are the questions that we've received so far, Alicia.
Okay, thank you. Keep the questions coming.
There's a raised hand I see.
Okay. The raised hand, do they have a question?
Yes, when is this going to start?
This will start, depending on what program you receive, this will start for Texas December 1st, 2020.
Thank you.
You're welcome. Okay, so let's talk about the EVV system. So what system will you use? The CDS employer will use the EVV system selected by their FMSA. So employers, if you have not received information or heard from your FMSA, please reach out to your FMSA soon, very, very soon, so you can go ahead and know who your EVV vendor will be. Contact your FMSA to find out which EVV system they have chosen or have been assigned. EVV vendor systems are accessible in accordance with the Web Content Accessibility Guidelines 2.0 standards. So check with your EVV vendor or FMSA for more information regarding system accessibility. EVV system definition. So what is an EVV system? An EVV system is an EVV vendor system or EVV proprietary system that electronically documents and verifies the critical data elements for a visit conducted to provide a service. An EVV vendor system is an EVV system provided by an EVV vendor that an FMSA or your program provider may select to provide EVV services. An EVV proprietary system is an HHSC approved EVV system that is purchased or developed by your FMSA or your program provider. So the difference is the EVV vendor system is part of the EVV Texas EVV vendor state pool that your FMSA or program provider may select, or your program provider or your FMSA may decide to use their own proprietary system. EVV critical data elements. Previously, we mentioned about those data elements. So critical data elements are similar to the information required on a paper timesheet. The critical data elements the EVV system uses to document and verify the visit include the type of service provided, the name of the recipient to whom the service is provided, the date and times the provider began and ended the service delivery visit, the location, including the address at which the service was provided, the name of the individual who provided the service, and other information necessary to ensure accurate adjudication of Medicaid claims. An example of that would be your FMSA or program provider information that is needed to adjudicate Medicaid claims. Excuse me. So let's talk about those clock in and clock out methods. So there are three methods a CDS employee or an attendant can use to clock in and out of the EVV system when service delivery begins and ends. One method is the mobile method. Number two, the home landline. Or three, the alternative device. So let's talk about the mobile method for a few minutes. So a CDS employee or an attendant may clock in and out of the EVV system using an EVV mobile application on their smartphone or tablet. The CDS employee or attendant must download the EVV mobile application onto their smartphone or their tablet. The CDS employee can use the EVV mobile application on their own smartphone or tablet, or their CDS employer's smartphone or tablet. So let's talk about that shortly, real quick. So those that selected the CDS option, you have the right to let your employee use your own smartphone or tablet to clock in and out of the EVV system, okay? If you have not selected the CDS option, the attendant may only use their own smartphone or tablet. They cannot, under no circumstance, use the member's smartphone or tablet to clock in and out of the EVV system. The mobile method, use that smartphone or tablet, is the only clock in and clock out method that may be used in the community. It only captures the CDS employees or attendant's location at the time of the clock in and the clock out. It doesn't track the location at any time, so it's not tracking that location at all. So let's talk about the home phone landline. So a CDS employee or an attendant may use a landline phone in the individual's home to call a toll-free number to clock in and out of the EVV system if the individual gives permission. Let's talk about the third method, the alternative device. A CDS employee or an attendant may clock in and clock out of the EVV system using a small electronic device that is placed in the home of the individual who received the services. For example, it may be called a token or electronic card. It depends on the vendor that the FMSA or program provider has selected. The devices, the alternative device, they're probably the size of a credit card. They're about the size of a credit card. So the CDS employee or the attendant must document the codes generated by the device, call a toll-free number to enter the codes into the EVV system, within 7 calendar days from the date of that visit. The alternative device may be obtained through the EVV vendor and will be mailed to the CDS employer. If you have selected the agency model, it will be mailed to the program provider, to that agency. One thing about that alternative device, it must remain in the individual's home at all times. So multiple clock in and clock out methods can be used. So a CDS employee or an attendant may use multiple methods to clock in and clock out of the EVV system. For example, the CDS employee or attendant clocks in using the individual's home phone landline. They then provide services to the individual in the community, so they clock out using the mobile method. Also, if there is more than one CDS employee or attendant, the employee or attendant are not required to use the same clock in and clock out method. For example, one CDS employee or an attendant may use the mobile method, while another CDS employee or attendant may use the individual's home landline. So let's talk about visit maintenance. The attendants have clocked in and out of the EVV system. Okay. Now, on visit maintenance, you'll hear that term. Visit maintenance is the process for making corrections to the clock in and clock out information in the EVV system to accurately reflect the delivery of services. It's similar to correcting a paper timesheet. So instead of using the eraser or striking through, you'll go through the EVV system and you'll make the corrections there. All required visit maintenance must be completed before the FMSA or program provider submits a claim for payment. So your program provider, your home health agency, or your FMSA cannot submit a claim for payment until all required visit maintenance has been completed. So approving time in the EVV system, okay? So when using EVV, time worked must be approved in the EVV system, okay? Now we're talking about the role of that CDS employer, okay? CDS employers or designated representative, DRs, are always responsible for approving time worked by their CDS employees. The CDS employer or the DR may log into the EVV system to approve the time or may delegate their FMSA to complete the system actions on their behalf. If completing visit maintenance is delegated to the FMSA on Form 1722, and we're going to get ready to talk about Form 1722, the CDS employer, or DR if applicable, makes their selection on Form 1722. Let's talk about Form 1722, which is the employer selection for electronic visit verification responsibilities. So, Form 1722 provides 3 options for approving time and completing visit maintenance in the EVV system. The CDS employer selects one option. If the CDS employer decides to change to a different option at a later time, they must complete a new Form 1722. Option 1, the CDS employer chooses to approve their CDS employees' time worked in the EVV system and perform all visit maintenance in the EVV system. Option 2, the CDS employer chooses to approve their CDS employer's time worked in the EVV system. However, they will have the FMSA perform visit maintenance in the EVV system on their behalf. Option 3, the CDS employer chooses to delegate EVV system actions to their FMSA. That means the FMSA confirms the CDS employer's approval of their CDS employee worked in the EVV system. The FMSA completes all visit maintenance in the EVV system on behalf of the CDS employer. Note, the CDS employer is always responsible for approving the time worked. In this option, the FMSA must have the approval from the CDS employer before taking any actions. So we've talked about a lot there. So let's take a little pause and let's see what questions we have received. Emerson, have we received any questions?
Yes, we've actually received a lot of questions, which is excellent. So let's see here. The first question we've got is, what happens if an attendant is out of the home? They're in the community. Does the system track the user? And the attendant can clock in and clock out in the community using a mobile application on a smartphone. The mobile application does not track the user during the visit. The mobile app will only capture a location when the attendant clocks in and when the attendant clocks out. Our next question is, what if the employee signs in late or forgets to clock in? And if that's the case, the program provider or CDS employer will have to complete visit maintenance to add the visit. The attendant must report the time in and time out to the program provider or CDS employer after the visit. Next question is, we have, my FMSA has not contacted me yet about EVV. What should I do? And for this, please reach out to your FMSA to inform yourself how they are participating in EVV. All applicable FMSAs have either selected an EVV system or have been assigned an EVV vendor by HHSC. Next question, are the paper sheets that are filled out in case of an issue with EVV, are those sheets required to be kept on file with the employer or submitted to the CDS? In the event of an issue or incident, the paper form would still be used and submitted to the case manager or whomever receives the forms today. Our next question is, I have not received any updates from my son's CDS since late February or early March. When is their drop dead date for training clients? The FMSA and CDS employers have a practice period from July 1st to November 30th of this year. The FMSA will onboard CDS employers during this time period, and the CDS employer will receive training. The drop dead date for using the EVV system is December 1st, 2020. Next question, how many choices of device systems do they have? And there are 3 approved clock in and clock out methods, and those include the mobile method, the home phone landline, and the alternative device. This next question, we actually need a little bit more information. I'll just go ahead and read the question to the person who asked it. How do I do have time and respite time if provided by the same attendant? So our question is, are the services simultaneous? And if you'd just like to add your response to the chat, then we can answer this question for you. So I'll move on to our next question. If the attendant lives in the same household, does he have to do EVV? And this one, we're actually trying to get a little bit more information to confirm this. And Alesia, you may know the answer to this, but we've got, yes, anyone providing EVV related services are required to use EVV. Do you happen to know if that is correct?
That is correct. So if they're in the home, if that attendant lives in the home as the member, they still have to use EVV.
Alicia,
Okay.
this is Linda. I was the one that put it in for a parent who texted me. Is that scheduled to change? Will it take state legislation? What would be needed to be with the rest of the United States?
As far as using EVV being required because of the CARES Act?
The CARES Act was updated so that if you live in the home, you don't have to use it, but Texas didn't move to agree with it. So
Correct. That was just that was not a requirement, and that was an option. And because the way Texas does its billing, a lot of our programs and our provider agencies and our FMSAs, the cost would be tremendous, and it would take time because each one of those services would have to be broken out depending on what they do, because our services, for example, in primary home care, so they're getting that home health care, and they have some tasks, for example, laundry may be done in the community if that member does not have a washer and dryer in their home. So our program and our codes do not separate the difference to say this is done in the home and this is done outside the home. So Texas, so we can meet our requirement, has selected not to go that way. So if the attendant is living in the home in Texas, they will have to use EVV.
okay, thank you.
You're welcome.
Thank you, Alicia. We'll move on with our next questions here. What if the attendant starts at the home and then goes out into the community with the participant and returns to the home prior to end of the shift? And the answer here is the service attendant will clock in using an electronic verification method that is associated with the member's profile prior to leaving the home. They can travel into the community with the member and will then clock out using an electronic verification clock out method upon returning to the home. Our next question, what if the attendant and the consumer are in the community at several different addresses during the time of service? And in this case, the attendant should clock in once at the beginning of the visit, either at home or in the community, and can wait to clock out until the end of the visit. If the attendant delivered a non-EVV service, such as transportation during the visit. Next question is, what if the attendant doesn't have a smartphone or tablet? And the answer here is if you do not have an option to use the mobile application, you may use the home phone landline or an alternative device. Our next question is, why is location important? Does it matter if the clock-in address is different from the clock-out address or different from the home address? The location is required as part of the data that must be captured per state and federal law. The clock-in and clock-out locations can be captured at different addresses, either in the home or the community, and the member can have more than one clock-in and clock-out method associated with their profile, even if it is located at a different address. And our next question is, when can the attendant use the employer's smart device for clock in and out? And the answer here is the service attendant can only use the CDS employer's smart device with approval by the employer. If the CDS employer agrees, the service attendant can use the EVV mobile application on the employer's smart device at any time. And let's see, we got a next question here. My attendant drives me to appointments and provides medical support services during the appointment. Will transportation time be covered? And transportation is considered a non-EVV service and will not be covered. Next question is, can an attendant clock in and clock out on two different devices for the same shift? And the answer here is EVV systems do allow multiple clock in and clock out methods. And we've got some other questions, but we're still answering those, so I'll be able to read those at our next Q&A break. So
Okay,
thank you.
Thanks, everyone, for the questions. Keep them coming. So now we're going to talk about EVV training requirements for CDS employers. Regardless of the option chosen on Form 1722, CDS employers must complete training on the EVV system, including clocking in and clocking out methods. Access to the EVV system will not be given until the EVV system training is completed. After initial training, EVV system training must be taken annually. So the EVV training requirements. The EVV system training, which includes the clock in and clock out methods, will be conducted by the EVV vendor selected by your FMSA if the FMSA is using an EVV vendor system. Your FMSA will be training you on the clock in and clock out methods if the FMSA is using their own EVV proprietary system. EVV training requirement for CDS employer, EVV policy training. Who is that conducted by? Your payer, which is HHSC or your managed care organization, or your FMSA. So CDS employers, you can take policy training with HHSC or your MCO or your FMSA. CDS employers, you must train your CDS employees on how to clock in and clock out of the EVV system. CDS employers will receive assistance from the EVV vendor selected by the FMSA or the FMSA if the FMSA is using their own EVV proprietary system. So your employers, remember, you must train your employees on the clock in and clock out methods. Remember those three methods was the mobile method, the member's home phone landline, or the alternative device. Who's going to conduct that training? The CDS employer will conduct the training with the assistance from the EVV vendor or the EVV proprietary system if your FMSA is using their own EVV proprietary system. EVV training registration. CDS employer and CDS employees training requirements and training options are included in the Cures Act EVV required training checklist, which is on the HHSC EVV website. To register for training for the EVV system, visit your EVV vendor's website or contact your FMSA. For EVV policy, visit the training section of the HHSC EVV website or visit your MCO's website for training opportunities. So Cures Act EVV expansion timeline. So the Cures Act EVV expansion timeline includes several important dates and milestones that must be met throughout 2020. Let's look at this first date. So July 1st, 2020 to November 30th, 2020 is the EVV practice period. This practice period allows CDS employers and attendants to learn more about using the EVV system. EVV claims will not be denied for a mismatch. And what that means is in order for your FMSA or your program provider to get reimbursed for services that are required to use EVV, they have to have a matching. That visit has to be in the EVV system, okay? During the practice period, if that visit is not in the EVV system, the claim will not be denied. So by December 1st, 2020, all required EVV training must be completed. That means employers, you must have completed your EVV system training and your EVV policy training, and you must have trained your CDS employees on the clock in and clock out method. Then on December 1st, EVV claims matching with denials begins. What that means is if your FMSA or program provider submits a claim for service required to use EVV, and if there is no EVV visit in the system, then that FMSA and program provider claim will be denied. So during the practice period, which just said was from July 1st to November 30th, 2020, and it was put in place to ensure everyone has the opportunity to practice using the EVV system prior to mandatory usage. CDS employers and DR designated representatives can practice using the EVV system to perform visit maintenance, pull and review EVV reports from the EVV system, and approve time worked by the CDS employee. The CDS employers and DRs should check with their FMSA for more information about the practice period and how the CDS employer can participate in EVV early. During the practice period, CDS employees and attendants can practice clocking in and out of the EVV system. By December 1st, 2020, CDS employers and DRs, if applicable, must complete training on, again, the EVV policy on the EVV system, including the clock in and clock out methods, which are the mobile method, the member's home landline, phone landline, and the alternative device. CDS employers must complete training on the clock in and the clock out methods. Note, CDS employers must complete EVV system training to receive access to the EVV system. Beginning December 1st, 2020, EVV claims matching with denials begins. All services required for an EVV required service must be captured in the EVV system. Claims without a matching EVV visit transaction will be denied for payment. This will impact reimbursement to your FMSA and will impact your participation in the CDS option. Let's talk about those EVV reports. CDS employers and DRs will be able to pull EVV standard reports in the EVV system. For questions on how to access EVV standard reports from the EVV system, contact your EVV vendor. EVV policy on reports, contact your FMSA. The standard reports located in the EVV system include the EVV Alternative Device Order Status Report, and that report can be used to verify that the alternative devices have been ordered and to track the status of those orders. So CDS employers, if you ordered a device and kind of want to know where it's at, if it's on its way, you can pull this EVV Alternative Device Order Status Report. The next report that's in the EVV system is the EVV CDS Service Delivery Log. This report displays the EVV visit data for CDS visits for a requested date range. This is similar to Form 1745, the CDS Service Delivery Log with written narrative and written summary. Next report is the EVV Landline Phone Verification Report. This displays numbers entered into the EVV system as landlines when the CDS employer's home phone landline as the clock in and clock out method. So in other words, this report can be used to determine, you can use multiple methods, okay? The telephone number that is entered, your member's telephone number that is entered into the EVV system as the home landline number, okay, so that number is captured in the EVV system. If they call from a different number using the home landline report, you'll be able to see that on this EVV Landline Phone Verification Report. The non-report, the next report and last report is the non-EVV Relevant Time Report. And this report will display the time that was spent on non-EVV services between clock in and the clock out for a requested date range. For example, non-EVV would be on that time, transportation. So let's talk about next steps for EVV. So next steps, CDS employers contact your FMSA to find out which EVV system they have chosen to use. Schedule and take your EVV system training. Complete Form 1722 and select your option for approving time and completing visit maintenance in the EVV system. Receive training on EVV policy. Find out when you can begin practicing using the EVV system. Sign up for electronic visit verification EVV email alerts through GovDelivery. Review the programs, services, and service delivery options required to use EVV. Document located on the EVV website. So check out the website and you can determine which programs and services required to use EVV. Contact your FMSA if you're not sure which program or services you receive. Review the HHSC EVV training checklist located on the HHSC EVV website. Resources. We have lots of resources out there. The following resources are located on the EVV website. We have the 21st Century Cures Act webpage. We have EVV glossary. We have a news and alert section. And we also have the EVV policy computer-based training, or CBTs, HHS learning portal. So you can click on that link and get signed up and go ahead and begin taking your EVV policy training. Form 1722 is located on the HHSC website. That was a lot of information. So let's see if we have any questions. Emerson?
Yes, we're getting lots of really good questions, so thank you everyone for sending in these questions here. Let me go back up to some of the questions we didn't get to answer during the last round. Here we go. What if the attendant and the consumer are in the community at several different addresses during the time of service? And the attendant should clock in once at the beginning of the visit, either at home or in the community, and can wait to clock out until the end of the visit. If the attendant delivered a non-EVV service, such as transportation during the visit, the attendant may clock out before the transportation begins and clock back in once the transportation has ended. Next question was, what if the attendant doesn't have a smartphone or tablet? And if you do not have an option to use the mobile application, you may use the home phone landline or an alternative device. And does the landline include voice over internet protocol, or VoIP, or the old school landline that is phasing out? And a fixed VoIP landline can be used to clock in and out. However, a cellular-based landline phone may not be used. When can the attendant use the employer's smart device for clocking in and out? And the answer is the service attendant can only use the CDS employer's device with approval by the employer. If the CDS employer agrees, the service attendant can use the mobile application on the CDS employer's smart device at any time. Our next question, if your house sits so far back on the lot that GPS apps think you are not on your street, but are on the one behind you, how will EVV handle this? And the answer, if the street address and GPS location are not correct, the FMSA can correct the GPS location in the EVV system to be more accurate. Once that's done, the mobile application should identify the member's home location when within the home. Our next question is, my attendant drives me to appointments and provides medical support services during the appointment. Will transportation time be covered? The answer is transportation is considered a non-EVV service, so it will not be covered. Our next question was, my FMSA said we can only choose one tracking method. Are you saying it can be done over multiple methods? And the answer here is HHSC allows an attendant to use any of the 3 approved methods. HHSC policy also allows an attendant to use one method to clock in and a different method to clock out. For instance, if the CDS employer has a landline phone and the visit begins in the home, the attendant can clock in using the home phone landline. If the visit ends in the community, the attendant could use the mobile application either on their own smartphone or the CDS employer's device. Our next question is, what is involved in performing visit maintenance? And visit maintenance is similar to making corrections to a timesheet. To perform visit maintenance, the program provider or the CDS employer will log into the EVV system and adjust information to complete or confirm a visit. Visit maintenance may include adding a clock in or clock out time if the a clock in or clock out if the attendant forgot to clock in or out, or adjusting the billable hours if the attendant clocked out after the visit had ended. Our next question. For those of us that have attendants that travel with us for appointments, what role will location play? And the service attendant may clock in and clock out from the home of the member, or if the visit begins in the community, the attendant can clock in at the community location. If the attendant clocks in or out using the landline or the alternative device, the location is captured as the member's home, since those devices must be in the home. If the attendant clocks in or out using the mobile application in the member's home, the mobile application will automatically capture member home, but if not in the home, the mobile application will prompt the attendant to select a community location, such as medical appointment or alternate home, etc. Our next question. Mapping and GPS apps, including the one on my iPhone, have my house located on the side street, not on my actual street. How will this affect EVV reporting location? And this one we actually already answered above here, where the FMSA can go back in and change that location so that it matches the member's home location. Our next question is each EVV vendor independent from each other in reference to requirements of clock in and clock out methods, the ability to use multiple devices, and location tracking? And the answer is that all EVV vendors adhere to the same EVV requirements determined by HHSC. Our next question is, what if the time in the community is divided up by transportation? And there are a few options when managing time to exclude non-EVV services such as transportation. A service attendant can clock in at the beginning of the service and clock out prior to leaving or starting the transportation service. Once the transportation service has ended, the attendant can clock in again to continue the EVV relevant service. Alternatively, the service attendant can clock in at the beginning of the service delivery and clock out at the end of service delivery, keeping track of the time associated with the transportation service. So at the end of the visit, the attendant can then subtract the transportation time or report the amount of transportation time to the program provider or CDS employer or FMSA, so that the transportation time can be deducted from the visit. And it looks like we've got another question here. If you have to train annually, is there a website for people who need this retraining? And yes, the EVV vendor, HHSC, MCOs, and TMHP may offer EVV trainings in different delivery methods, such as, but not limited to, computer-based training, instructor-led training, and webinars. You can contact the EVV vendor, HHSC, an MCO, your MCO or TMHP for details on specific training delivery methods. And we still have a few more questions to answer, and I'm seeing that we have some more questions coming in. So what we can do is take these questions here and Alicia, will we be able to answer these questions live, or should we? I wasn't here for yesterday's presentation, but how was that handled?
So what we're going to do then, if we're still answering questions, that's great. If we don't have time or we just need time to still answer those questions, we will be sending those questions out and we'll work with Linda. We have everyone's address who registered, and we'll send a copy of all the questions and answers, all the questions, and then the answers to those questions within 2 weeks.
Alicia, there's a couple things that I've heard in all the meetings I've been to that we might want to mention here, if that's okay.
Yeah.
So what has been clear in this are that people are worried about the things that don't go on EVV. For example, in HCS, transportation will not be covered by EVV, and I think people are texting me and thinking that transportation will no longer be paid. That's not true. We still all get paid for transportation or supported employment or bonuses or respite. It's just not going to be part of EVV. It'll be on another timesheet, and every time it's come up, we've heard, well, your FMSA will figure out how they're going to get those hours from you, and it'll be separate. And so each FMSA has now got a license to do it differently. And so that may cause us to want to change FMSAs if that piece of it, that transportation, that supported employment, that respite, or the bonuses, which right now in our household, we're paying bonuses on every timesheet, you know? And so everybody's real concerned about that piece, and it's not being talked about today, but you're not going to lose any money for that piece. And I just want to allay everybody's fears about that. And the other thing that didn't get mentioned, and this is just for a subset, if you've got a ramped van and you drop your kid off at college or work, and you've got to get the van back home, you're no longer with your kid anymore, and technically you were supposed to sign out at the dropout, but your shift isn't done if you're still driving a van home back to your car. And we even talked about some families don't want the employee to be in their house just to sign out. So it was arranged with HHSC that there could be a lockbox at the front door, and an SAD device could be in the lockbox, and you could drop off the car, put the key in there, sign out through the lockbox, and go home. And that way you would get your half hour or hour of being in traffic to get the van back home still paid for, because you're really not at the end of your shift till you get back to your car. Thank you. That's all I had.
Thank you, Linda. Emerson, do we have any other answers available?
Let me take a look here. Just real quickly, we're actually in the process of getting some answers here. So I'll let you know once we do have a couple more answered questions.
I am going to try to pull up, I'm going to try, since we have the doing questions, our HHSC EVV webpage.
So I'll leave it pointed to you.
So, can everyone see that, my screen on the HHSC EVV webpage?
Can you take it to a higher percent, please?
I'm sorry, what was that again?
Could you take it to a higher percent, please?
Okay, let me see. Uh-oh.
Thank you.
How is that? Is that better?
Mm-hmm.
Okay, great. So this is the HHSC EVV website. It has some great information on here. We're constantly updating it. It talks about, of course, our temporary policies for COVID, and then it talks about what is electronic visit verification. Then if you scroll down, you'll see a lot of different kind of tabs, okay? So if you click on the first one, this is going to tell you all the programs and services required to use EVV. The second one talks about the Cures Act, and this page is important for those in those new programs, the programs CDS, HCS Texas Home Living, DBMD, our YES waiver, adult mental health waiver. These are our new programs and services required to use EVV as a result of federal law. So if you click on that page, you'll get some good information. Then we talk about compliance. Okay, HHSC does compliance. This is primarily right now for our current providers and non-CDS, so it has nothing to do with our FMSAs at this point. Okay? Our next tab, if you look, is our contact information. So we have a contact guide. We need to know who to contact. The next tab talks about forms. In here, you will see the rights and responsibilities that we talked about. And it's in Spanish and English. And then we have Form 1718, which is for managed care, their EVV rights and responsibility. We have a visit maintenance unlock request. That is going to be used for visit maintenance. You have 60 days from the date of the visit to complete visit maintenance. If it's after that 60 days and you need to open that visit maintenance, you would click here, go here to forms and click on visit maintenance unlock request. Next tab, this lists our policies. Now these are not all of our policies. These are policies that have been developed but are not currently in the EVV policy handbook. So every time we get ready to revise or create a new policy, it will be posted here. You will see the EVV vendor selection. Of course, that's for your FMSAs and program providers. And then we have our policy handbook. You would go again to policy and you would click on the policy handbook, and there you can find all the policies. Now those that are listed here are not currently in the policy handbook. Once they're in the policy handbook, they will disappear from here. The next tab talks about the proprietary systems. This is if your FMSA or program provider has decided to use their own EVV system. That's where they would go and get information. The next tab talks about reason codes. So reason codes are used. So CDS employers, if you decide to do visit maintenance, you must select the most appropriate EVV reason code number, reason code description and option, and enter any required free text, okay, when performing visit maintenance. So those reason codes will tell us the reason why visit maintenance or correction was needed. We have a services bill code table. This bill code table is used primarily by your program providers and FMSAs because it equates what is that bill code associated with the program and services required to use EVV. The next tab we have are statute and rules. And then we have our training, okay? So this is our training page. So our Cures Act training checklist, let's click on this. So if you click on that, it's going to take you to the EVV Cures Act EVV training requirements, our checklist. So if you are a CDS employer, you can click here. CDS employers using an EVV vendor system, okay? So here it will tell you all the training requirement and when it must be completed by. It'll also tell you the CDS employees, the training that they need to take. Program providers and FMSAs use a proprietary system. So this checklist, it's really good if you need to remember which training, when, and the requirements you have to take it by. Then, if you sign up for Gov Delivery, then here you can see it gives you the date and the title of every time we do any kind of update. You can click on that. So on July 2nd, we extended the EVV users currently using it. Our temporary policies for COVID were extended. If you look over here on the right side, get EVV email updates. If you click on that, right, you can enter your email, and it'll take you to the next page, and then you can sign up for EVV alerts once you select it. Okay. So Emerson, do we have any answers available?
Yes, we do have some more answers here. So let me start with the first question here. If the transportation isn't covered by EVV, how is the employee paid for that time and service? HHSC does not require EVV to be used for transportation services. However, transportation services will still be paid as they are today. The time spent on transportation will be reported separately to the program provider or the FMSA. Next question, why is transportation not covered? What if transportation is included in the annual budget? If it wasn't for transportation provided, a waiver client couldn't get to aquatic therapy, go grocery shopping, pick up curbside food, etc. And again, transportation will still be paid. However, EVV is not required for the transportation service. The time spent on transportation will be tracked separately from the EVV services. Next question, is EVV system only accessible by the employer? Employees/attendants can't access the EVV systems, correct? And that is correct. The CDS employer or their designated representative can access the EVV system and make any necessary corrections. The service attendant can only clock in and clock out using one of the 3 approved electronic verification methods. Another question here, will we still be filling out paper timesheets as a backup for verification each pay period? And the answer is once EVV is fully implemented by your program provider or your FMSA, the attendants will be clocking in and clocking out of the EVV system during visits, and paper timesheets will no longer be required. Some programs may still require documentation on a service delivery log, however. So please check with your program contact. Next question. If the employee forgets their phone or it's broken, can the employer log in for them on their own phone? And the answer is the CDS employer cannot log in for the attendant. However, the service attendant can use the CDS employer's phone with permission from the employer. The attendant must always use their own login credentials, and the login should not be shared. Next question is, I read that we can purchase a smartphone to keep at the home for EVV. We do not have a landline. Will this be covered by the FMSA? A smartphone is a good substitute for a landline and can be used in the home to have the attendant clock in and clock out. A smartphone or a tablet is an allowable expense within the CDS budget for administrative costs, and the FMSA will not provide the smartphone. Next question. If the, sorry, 1 second here. We're just finishing up with an answer. I think this one is our last question that we have answered here. But I do see that there are more questions coming in, so I'll be sure to pick those up. So if we don't get to them today, we'll definitely be able to send out the answers to those questions to all the attendees today.
Correct. Okay, so that's the end of our presentation. And again, like I said, we will be finishing up all the questions. We will be sending written responses to all the questions in approximately 2 weeks, and we'll be working with Linda on that to make sure they get out to everyone that's on this presentation. Linda?
Thank you. Can you take your screen off and we can see everybody to say
Yeah.
goodbye? Thank you.
Yep.
We are very appreciative of you all for coming to teach this today. And this is our first taste of this, and it seems like we're going to need some more training. And especially to get back to our FMSAs and find out about recording the other piece of this. I guess I'd like to work with you all about that piece so that we have some kind of standard for doing the rest of the time, because this is just part of the time that we will be reporting. And we'll need to focus for a while on the other part as we become trained. Thank you ever so much. And would you all be willing to come back again after we get a little bit farther into this? Maybe when we're more savvy about it and want to fine tune it a bit, would that be okay?
That would be great, Linda.
Okay, thank you ever so much. You all were wonderful.
Thank you so much for the great information. We really appreciate it.
Mhm.
Okay, everybody stay safe out there.
Thank you. You
Bye.
too.
Thank you.
All right.